You are listening to the global network of podcasters dedicated to the pharmacy profession. Welcome to the Pharmacy Podcast Network.
Welcome to the Vaccine Confident podcast series, brought to you by the American Pharmacists Association. Over the next 3 episodes, we'll explore the critical role vaccines play in saving lives and protecting public health. Vaccines undergo rigorous testing to ensure they're safe and effective, offering long-term benefits for individuals and communities alike. By preventing the spread of serious diseases, they protect those who are most vulnerable, like infants and those with weakened immune systems. We'll tackle important topics like combating misinformation, understanding mild side effects, and addressing common questions, including concerns about fertility and the rapid development of vaccines like those for COVID-19. Join us as we empower you with credible information to build vaccine confidence and promote healthier communities. Let's dive in and learn how vaccines truly save lives. And now, here's part 3 of Vaccine Confident.
Hey, welcome back. My name's Todd Urey with the Pharmacy Podcast Network. I am thrilled to be part of the APhA Vaccine Confident podcast series. This is part 3. Don't worry. If you haven't heard part 2 or part 1, you're going to go down to the show notes. We're going to have a link. You're going to be able to look up all 3 parts. Please share these podcasts with other pharmacists in any of our settings and other healthcare providers that you work with. All right, Brigid. We're part 3. It's exciting. We're going to be talking about accessing vaccines at pharmacists with interactive maps.
Awesome. Thanks, Todd. Really pleased to be here. And yeah, I encourage you to check out the great content on episodes 1 and 2. And episode 3, we're focusing on how to find a pharmacy that has potentially vaccines near you. So we have worked with Luke Berenbrok of the University of Pittsburgh and some of his colleagues to create these maps that are user-friendly and are accessible online on your phone, and really help to hone in on what vaccines are available near you at a pharmacy. Luke, would you mind, kind of kicking us off here, describing what these maps are, where does the data come from, and how we might be able to use them?
Yeah, I'm so excited. I feel like it's my directorial debut at the Sundance Film Festival. Brigid, I think that makes you my producer here, so hopefully you have a sense of pride in this too. I'm gonna just give you all a tour here of the beautiful APhA Vaccine Confident website, and we're gonna look at these 2 maps that are kind of front and center. The idea here is that we created 2 maps, one for the public. This is going to help them find a vaccine, and then one for healthcare providers. So think pharmacists, physicians, nurses, any type of public health expert or official who want to see kind of the coverage that pharmacies have across the United States. This is very specific to community pharmacies and outpatient pharmacies, places where people can walk in and get a vaccine. So, let's start with the public vaccine access map, because this is something that really came out of this idea that we need to show people where they can get vaccines. And it's not that hard to find one. We have this stat, 90% of Americans live within 5 miles of a pharmacy. That number is going to fluctuate with recent closures, but we want to make sure that we still kind of lean into this accessibility and this trusted role that we've been talking about in all 3 episodes. This is available to everyone. It's not behind a firewall or a paywall. So again, this is meant for patients and others who get on the site to find a vaccine. And I'm going to show you how you can direct others to use the map and the tool. Really quickly, I want to acknowledge Alec Brown. He is a GIS, Geographic Information Systems master student at the University of Pittsburgh, and he was behind creating these maps. So thanks, Alec, for that. And this data was obtained from NCPDP, their data queue. And we're really excited that this data will refresh monthly. So whenever a pharmacy opens, you'll see new points. And unfortunately, whenever a pharmacy closes, they'll be removed from the map. So it's going to give you some month-to-month real-time pictures of where to receive vaccines across the country. So we're going to zoom into Pittsburgh here. That's where we are right now. You can see a bunch of green triangles popping up, and the legend is over here in the bottom left. These green triangles means that a pharmacy offers immunizations without an appointment during business hours. So you can show up, you can say, hey, I need a flu shot. Hey, I need a COVID booster. Hey, I'm due for the second shot in Hep B series. And that pharmacist is going to help you out, or that pharmacy technician, depending on state laws. And then there's some purple circles, and those purple circles are going to show you that immunizations are offered, but only on select dates and times. So you can direct your patients to give that pharmacy a call before they show up. And then luckily there's even fewer of the orange squares, and these are pharmacies that don't offer immunization services. And there's some magenta diamonds that the pharmacy just hasn't reported whether they do immunizations or not. And a good rule of thumb here is that a patient using this should really be calling the pharmacy before they show, just to confirm that this information is correct and that they can get a vaccine that day. We don't want people to be turned away with that principle that, if they're in front of you, let's immunize. Okay, the other cool thing here is that as you scroll in and out, it's a little dynamic. So the numbers will kind of start to go away as you get closer to the street level. And then you can see the coverage that we have here in Pittsburgh of the pharmacies, and we're looking for those green triangles. That's what makes it easiest to get an immunization. We can toggle on, or in this case, off the pharmacies that don't do immunizations. This one is really important, the accessibility for patients who need that. In Pittsburgh, we have lots of hills, so we want to make sure that we have pharmacies open for people who need some extra help. And then we can also filter for pharmacies in which you don't need those appointments, and you'll see those purple dots go there. The last thing that we're really passionate about when it comes to accessibility is pharmacies that offer language services. In case you're serving a community that has a really high population of non-native English speakers, or patients or members of the community who English is their second language, you can filter by tons of different languages here in which the pharmacy or pharmacist can speak in a preferred language for their patients. And you'll see those types of languages increase as we... the last thing I want to show you here is what happens whenever you find a pharmacy that you like. We can type in an address here to find a location. Let's use our current location here. I'm going to type in this, the city.
And Luke, you could actually type in a patient's home address, for example.
Yeah, of course. Yeah, you can do house number and street. And here we got a pharmacy. And then you'll see some information about that pharmacy, including the name and phone number. It links to navigation apps, Google, Apple, and Waze, and gives you a little bit more of those attributes that the pharmacy reports to the NCPDP data set, including hours and language spoken. So really the point of this map is to make it as easy for a member of the public to find a pharmacist that would be willing to vaccinate them, and to make sure that that person can follow through on getting that service that's so important.
Awesome. Luke, I think this is, from a patient standpoint, pretty user-friendly and easy to use. We can access this on our phones, right? So if I was, out running a clinic, or if I'm a patient out on the road, I wouldn't be using my phone while I'm driving, but...
Yeah, I'm using the desktop version now, but there's a mobile version. So anyone who wants to pull this up on a smart device, tablet, or cell, you'll get to see the same maps with the same toggles and filters.
Wonderful.
Yeah, making it really easy. Yeah. The other things I want to point out here, if you need a little bit more direction on how the map was generated or how to use it, there's some directions that you can download here. And then if for some reason you're a pharmacist owner or a pharmacist and you think, oh, you know what, some of this data needs to be updated or something's not quite right whenever I type in a nearby address or I look at the attributes assigned to my pharmacy, you can report some updates by clicking here. It'll take you to a survey, And then that kicks back to our team at the University of Pittsburgh, and we'll get this information updated for you. So it's real time, and it really helps people in the moment.
Yeah. So Luke, one more thing on the patient side of things. If I'm looking for a specific vaccine and I want to know if the pharmacy has that one in stock or if they give that vaccine, how would I find that out? Or do I need to call somebody? What do I do in that case?
That's where the phone number is going to be your best friend. And it's so difficult to know which vaccines, which pharmacies give, with the difference in state laws, rules, and regulations, also with differences in availability and when there's more than one manufacturer of a vaccine. So we're a little bit silent on that in this map just because that data is very difficult to find and to collate and to keep current. So if you have a very specific question, maybe of travel vaccines that not everyone keeps in stock, always give a call before you show up.
Great advice there. All right. Well, I wonder now about, you mentioned on that homepage that there's options for healthcare providers. So, maybe physicians, nurse practitioners, nurses, those that are working in the health department. What can they see and utilize the map for?
Okay, so that's exactly right. I think if this public vaccine access map, the headline is share this with the patient, help them find a vaccine that they need. The headline here with the provider vaccine is share this with colleagues, let's promote the team approach, and let's get people thinking of pharmacists whenever we think about immunization delivery and administration and being accessible. So this one's going to look a little bit different, but with the same theme, same navigation. You can see it's still a map of the world with similar legends, but we have a couple extra little overlays here, and these are called map layers. And this is really meant to help with the public planning process, being that public health expert that Mitch was talking about and engaging other people in the community to say, hey, these are where pharmacies are located. These are the types of patients that this pharmacy can reach that other providers can't. This is our unique role and value as the most accessible and a trusted clinician from coast to coast. In Alaska and Hawaii, we have those mapped too. So you see that we have pharmacies that you can toggle on and off. Something that, of course, is really important to us is medically underserved areas where we can fulfill needs where others can't. And you can see how those are shaded there. When you click on a shape, when you click on a pharmacy, that's a point. When you click on a shape here, it'll give you some details of the designation, what that means as far as an MUA. You can find that in the attribute table here. We have some other things, the similar but different health professional shortage areas. Again, you'll see shapes pop up in which you can find a little bit more about where that is and how it's labeled. And then SVI, which Brigid, you may know, is becoming really important when we look at pharmacies and the unique roles that we fulfill in urban and suburban and rural counties. And so these SVI, which is a measure of social vulnerability, you can find a lot of different attributes and data that show you why a pharmacy is needed in this particular area. And then lastly, we were able to expand upon some of my previous research that mapped the distance to a pharmacy, showing how close people live. And so you can see some shapes that show percentage of the population that lives within 1 mile, within 5 miles, and within 10 miles. This isn't necessarily for you to pinpoint a specific pharmacy, but to show and take to a collaborator or to a legislator or to a public health expert or planner and say, hey, this is why pharmacies should be engaged. This is why pharmacies can and should be a part of Vaccines for Children program, or this is why it's so important that pharmacies can get paid for the vaccines and for giving them. And so that's where you might use those. And then, of course, we know that a lot of health department and health planning is by county, not just by state. You can turn on those borders so you can see a little bit more about how your county is represented in the state that you live.
Excellent. Yeah, I think in particular, I want to pull out the point that you were making around the partnerships and recognizing that different vaccines are offered by different healthcare professionals in the area, by different local health departments. So referencing back our immunization neighborhood that Mitch had shared with us in episode 1 and how we can really work together to build that as a local health department or other public health entity popping into here and finding out which one of those pharmacies are around. One question, and I'm hopeful, Mitch, you might be willing to chime in here. If I'm a public health provider or other entity and I see that there's pharmacies right near me, how do I get a hold of them? What's the best way to outreach to them to try to build that relationship and that partnership?
Well, the best thing is to call your local health department. Each jurisdiction is set up differently in many ways. Some have a lot more local health departments. Some have, I'll call them regional. They have a bigger geographic, but all of them also have a state health department. And so there's usually an immunization coordinator at those different levels, and I would reach out to them to let them know. We've got a lot of interest and effort from public health, but also a number of pharmacies of engaging within the Vaccine for Children's program. And so we're looking for providers to engage in that. So that's another way of connecting with your health department. And with potential changes in policy coming down the pike, a lot more is going to happen at the state level than at the federal level. So that relationship with the state health departments are going to be important. Their level of funding is still to be determined, but they're starting to see the value of collaborating with those community-based pharmacies to get both education as well as delivery of services out to the community. And within pharmacy, we're now doing community health worker, looking at social determinants of health. So there are opportunities for additional funding for pharmacies for services that those pharmacies can provide.
Wonderful. Thank you. Luke, this was an incredible overview of the different maps and items on there. Is there anything else that you didn't have a chance to share with our listeners yet on either the use of these or some of the behind the scenes details? What's coming up in part 2?
Yeah, Brigid, we should mention this is year 1 work. And so we have a few more years on this grant. You mentioned the funder, which is the CDC. And we're hoping to add additional detail, add a couple extra layers. If you have any ideas, you can still use that link, not to report a concern, but to report an idea. And maybe you will see your idea on the map sometime soon. So thanks for listening and watching today.
Yeah, I want to remind folks that this is available for you all on vaccineconfident.pharmacist.com, and you can access it on the web or on your browser, on your phone, anywhere that you can get onto that internet access there. So we encourage you to share and know that this is something that you individually could use, but also to help if you're a caregiver for somebody, if you're traveling somewhere and you're across the country and you just want to see what's available. Pop in there, check it out. And then, as Luke mentioned, feel free to provide us with some ideas and feedback through that link on those pages. On behalf of APhA, really appreciate everyone listening and joining us today. I want to extend some extreme kudos to my colleagues, Mitch Rothholz and Luke Berenbrok, for the excellent work that they've been doing within vaccine space for many years, but also to participate on our 3-part episode series. Thank you.
Thanks, Brigid.
Thanks, Brigid.